So my name is Elizabeth. I'm 32 years old, and my healthcare experience began. I became really cognizant of it when I was really young, and part of that was because when my parents got divorced when I was 8 years old, they both were single parents with 4 kids, two of which had severe asthma, and neither of them made enough to really pay for health care for us, and so we were immediately dependent on Medicaid. And in Maine, where I grew up, it was called MaineCare. And I remember being so hyper aware of my siblings' asthma and the frequent asthma attacks. And I don't think it was until I was a bit older when I realized um, that our ability to get medicine for them, our ability to go to the hospital when they needed it, our ability to go to the doctor was 100% because of having the support of the Medicaid. And when I got a little bit older, I think I was probably 13 or so, I realized that the flip side of this was that in order to have this health care, my parents had to make under a certain amount of money. And I realized that we didn't have a lot of money. So that part made sense to me. But what didn't make sense to me was that on the flip side, that meant that neither of my parents could afford health care for themselves. And so while the four of us kids were covered, thank God, neither of my parents were covered. And it was particularly scary when I was a young teenager and my mom had uterine cancer and had to undergo surgery. And she ended up being okay. But I realized sort of the sacrifice that she had made in making sure we were all protected before she was protected, and how it could have ended up so differently. When I think about the health bill that the Senate has put forward, and when I think about the iterations of this conversation about healthcare in America, what I don't understand is how you can tell these parents who are doing everything that they can to support their babies, to support their kids, who are giving up their own ability to have health care because it is more important for them that their kids are covered than that they make more money, that they are themselves covered. How can people think that that is an easy choice for anybody? It's an economic issue, it's a moral issue. It really defines who we are in our ability to think about taking care of each other, um, and it is truly short-sighted to think that that healthcare is a privilege and not a right.